we are a large population with a high disease burden, right? And scale is a key imperative for the healthcare system. And pricing services for enabling mass consumption, like we've seen in other sectors like telecom, retail, is really going to be important. This needs deep pockets, Ekta, or long-term players with a future commitment in healthcare. That will take time, and we all know that healthcare is a high capex investment area with a high gestation period. The private sector, enabled and fueled by private equity, has made these rapid strides, right? So on one side of the equation, driving ARPOBs of 35 to 40,000, which is really value healthcare at the core. And also on the other side, innovating the business model. The median return on capital employed of the top few players was 5% 5 years back. It is 13% now. These are dignified returns, Ekta, despite serving the affordable agenda for the country. And cost innovation is in our DNA. And what private equity brings in access to capital to set up beds in underserved areas in tier 2 markets. And that's the juggernaut which has really been fueled by this capital.
All right. Varun, I just wanted to get your thoughts on this particular private equity piece in the hospital space, because if you look at it, a large amount of the conglomerates or hospital companies in India now either have some private equity investment, or many of them are even controlled by private equities, and the control seems to be switching from one PE fund to another PE fund. So just before we get talking about the report a little more, just wanted your thoughts in terms of what the way forward would be when it comes to the holding structures of a lot of these hospitals in India. Will it be PE run? Do you think that that's only going to incrementally rise from here on?
So first of all, thank you, Ekta, for having me on the show. I think the way I see healthcare is not PE run, it's management run, but PE invested. I think that's the way first I see it. See, I think carrying on what Kaivaan said, Ekta, a lot's happened in India. I think we should understand what's really fueled this access. So, and access has been enabled in this country, and I still don't call it completely because it's not equitable enough. But the way I see it is that we've doubled our bed capacity over the last decade and a half. And we're still not there. We're still about a bed to 1,000 people, whereas the need is significantly higher. We are almost half of what our bed capacity should be compared to the global averages. And when I say the global averages, I'm not taking the Western world or the highest averages. So to develop that kind of access, we need a lot of capital to come in. I think private equity has been able to bring that capital, and we need to enable sustainability as well, because no one's going to bring in capital if sustainability doesn't come in. But the good side is that now India, with that money, is being able to develop access in tier 2, tier 3 cities. As I said, when essentially we saw private healthcare coming in over the last 2 odd decades, it actually went to tier 1 first. Let me ask you this question. If you look at healthcare 3 decades back, and I was on the other side, on the receiving side of healthcare, when I went for my dad's transplant, India would do transplant in 3 to 4 cities. Today, the same procedure and more complex stuff is also available in significantly more cities in this country, and I think India needs that. I'd see, and again, when you look at the frugality that India has been able to show to the world, I mean, we still deliver very high quality healthcare at $300 to $400 per day. Those are the kind of ARPOBs that we run in India. It cannot be compared. I mean, there's no other place in the world, and I'm talking about, again, the developing world. I was in Indonesia, a year ago. I used to run hospitals there, and same GDP per capita. When I see the cost of healthcare in Indonesia, it's actually 3 to 5 times of what we have in India. So I think in India, we've been able to show the word frugality. It's now time to show a mix of frugality and quality. And I think that is being enabled by a lot of people who are looking at efficiency and quality work.
Absolutely, Varun. Important points made there. I'm just going to pick up a point from what you were making, is that there is still some more growth that is still left, a lot of room for growth versus other peers globally. Kaivaan, coming to you, then does that mean we'll see more funding that will come in? And tier 2, tier 3 city side of hospitals or healthcare, will that see the key focus now in terms of investments?
No, very much. Even today, while Varun spoke about the fact that we have 1 bed per 1,000 on an average, what we really measure is quality bed density per 1,000. The metros today are probably zero point 0.5, zero point 0.6 per thousand. The tier one cities are sub zero point 0.2 per thousand. So there is this huge demand supply gap which is there. And, we've covered this in the report. I think the India of the next 25 years is going to be very different from the India today. 49% of our population is going to be above 40, right? Versus 23% at the beginning of the decade. That's 82 crore Indians. And of that, more than 30 crore are going to be above 60 years, right? We're seeing the whole onset, and I would say we need a crusade in a way against the non-communicable diseases, right? Today, 65% of our disease burden is in the non-communicable disease space. And what we are also seeing, unfortunately so, comorbidities, right? 5% of our population today has more than two conditions, right? And that's going to go up to 25%. So that's a huge change that we are seeing. The advantage that we had is very soon going to become, a crisis situation over the next few years. So until we focus on longitudinal care, prevention, preserve our cost advantage, our healthcare spend as a percentage of GDP is going to double, 7% of GDP, which a country like ours can't really sustain. If we focus on these themes, right, we can still limit it to 5%, closer to something where China is at, and we'll probably need another million beds. We'll be below 2 beds per thousand, and that's the right mantra for a country like ours to really drive mass healthcare at the last mile.
Right. Well, Varun, before we let you go, this report also highlights the challenges that Indian hospitals face. And if you talk about challenges in the recent times, there has been some amount of friction with insurance companies and hospitals, possibly because of the lack of revision of rates and receivables piling up. Where does that situation stand with hospitals and insurers at this point in time? And just an additional part of it is that the CGHS rates were revised very recently. How beneficial is that?
I think, again, the macro picture is slightly different from what you currently read. I think I won't go much into the last quarter. But macro, if you look at it, the out-of-pocket, which used to be 80 odd percent, out-of-pocket expense in healthcare used to be 80 odd percent a decade and a half ago. And that's now gone down to 39, 38%, which is incredible. For a country like India, can you imagine 62% of the people are getting healthcare, which is not funded by them? And I think kudos to three things that have enabled that. One is the insurance schemes that the government has run. Universal healthcare programs today are making it affordable for the common man or accessible to the common man to get into a hospital. Second, I think the insurance penetration, which is the private insurance penetration, is getting better. I think it's moved into low double digit now from single digit, which is pretty good. So about 200 odd million people have private insurance outside of what their companies would insure them for. And then, of course, there are these state schemes which are again enabling that access. Now, again, sustainability is key to growth. We've all been talking about developing the million odd beds that the country needs in the next 7 to 10 years. That has to be enabled, and that can be enabled only by three things. One, the talent being there. So our industry is nothing but talent, technology, and infrastructure. And when I look at talent, I think we should thank the education system that we are today enabled by that talent. We'll be producing 1 million odd doctors over the next 7 to 10 years, which would mean that we can enable 1 million beds because each bed needs a single doctor to come in. Outside of that, the other two that I spoke about, which is technology and infrastructure. See, the cost of technology and infrastructure in India is the same as now anywhere else in the world. We still import the technology, and infrastructure in India is no longer cheap. Today, buying land and building, it doesn't. So I think all of that is a business cycle. And yes, we've had challenges in the past where rates have not evolved. They haven't gone up. Even medical inflation has not got covered. So I think that's something which is now happening. There is rationalization that's happening. On CGHS, it's a very important step. I think we've been talking to the government about it, and we are very happy that government is